Let us look into safe injection policy. What is safe injection policy? A safe injection is one that does not harm the recipient, does not expose the provider to any avoidable risk, and does not result in waste that is dangerous for the community. Safe injection practice involves administration of rational injection by a well trained, qualified person using sterile syringe, needle, adopting sterile technique, and disposing the used ones in a puncture proof container. Any breach in the process makes the injections extremely unsafe and hazardous to health worker as well as the recipients. The common infectious agents such as hepatitis B virus, human immunodeficiency virus, hepatitis C virus, and some bacterial infections which create a major problem related to unsafe injection practice. These viruses can remain silent in the body for a long time before they cause symptoms. Thus, unsafe injections can lead to disease that occurs many years after the original events. What are the causes of unsafe practice? Lack of awareness of the risk of unsafe injections, overuse of injections for medical illness for which effective oral medications exist, needle stick injuries to healthcare workers from recapping needles, lack of clean working space, reuse of syringe, and unsafe sharp collection and waste management. The other causes are using syringes, needles, cannulas for multiple patients, accessing medications or fluid containers with used syringes, needles, cannula, and then inadvertently administering the contaminated content to the other patients, cross contamination during preparation of medications and fluids. What are the ways to administer safe injection? It includes use a new sterile single use device, use the right medication or the vaccine, use aseptic technique. Provider should wash his or her hands with soap and water, a clean work area, and proper disposal of sharps. Following are the critical steps, the ways to protect the health worker from any avoidable risk. Ampule breaker should be used while opening the glass ampule, tray to be used and collect glass pieces. Gauze piece can be used to avoid injuries. Prior to access, wipe the medication vial or ampule neck or access port with 70% isopropyl alcohol and let it dry. Prepare medications as close as possible to the time of administration. When multiple dosage of the same medication must be administered to the same patient at different times, then using aseptic techniques either by drawing the entire content of a medication container into a sterile syringe and then administer sequential doses to the same patient, or draw sequential doses using a sterile needle each time the vial is accessed. Briefly on sharps management. The waste produced during a surgery or procedure should be handled in such a way that it does not cause any hazard to other people. The used sharp waste should be immediately disposed in sharps container. Close and change new sharps disposal container when it is 3/4 of its volume. Avoid removing, recapping, breaking, and bending of the sharps. How to reduce needle stick injury and its effects? Staff awareness is important. Training and monitoring is essential. Pre exposure prophylaxis is mandatory, that is, vaccination prior to exposure, 3 doses of hepatitis B vaccine. Needle stick injury can be caused with disposable needle, sharp suture needles, intravenous catheter stillets, scalpels, phlebotomy needles, and side ports. The common sharps that are used in operating theatres that can cause needle stick injury include side port blades, keratome, and disposable needles, especially the 26 gauge bent cystitome. How does a needle stick injury happen? It happens when a patient moves suddenly and the needle then pricks the healthcare worker, or the procedure is done in a hurry, or while recapping the needle, or from unattended used needles, needles that were found in the used linen, and during instrument and knife cleaning procedures. Following are the guidelines to be followed while handling sharps. Never recap the needle as it is shown in the picture below. If unavoidable, recapping has to be done, then it can be done with a single hand scoop technique. All sharps are disposed in a puncture-proof sharp container only. Proper protective wear should be worn before handling the sharps. The right way for sharps disposal: dispose needles only in the sharps container in a proper way. Needles should not be popping outside. Empty sharps container whenever it is 3/4 full. Needles should not pop outside. Sharp instrument must always be passed by non-touch approach, not directed by hands. Place the sharps over the tray while you hand over to others. Fingers should be placed away from the port from where you release the blade, as shown in the picture on the right side. As handling of sharps are done under the microscope, safe handling as shown in the video is required. Do not handle more than one instrument at a time. What are the precautions during surgical procedure? Protect fingers from injury by using forceps instead of fingers for guiding sutures. Always dispose of your own sharps by locating sharps disposal container close to the point of use. If you experience a needle stick injury or a sharps injury, what to do? First, do not panic. Wash needle sticks and cut with soap and water. Do not squeeze wound to bleed it. Do not use bleach, chlorine, alcohol, betadine or any antiseptic or detergents. Do not put pricked finger in your mouth. Apply a waterproof dressing. In case of any needle stick injury, inform the department supervisor and the hospital infection control nurse. The infection control nurse is responsible for collecting the blood sample from the injured person for serological testing. If the source is known, collect blood sample from the source patient or the person for the serological testing. If the results are positive, initiate the post-exposure prophylaxis. This refers to the medical management to prevent an infection following an occupational exposure. If the test results are positive, the staff must contact the general physician for further treatment. Start the treatment as soon as possible. Adhere to the advice and follow up regularly. Repeat the test as it is advised. Initiate post-exposure prophylaxis within the golden hour, that is the first 2 hours of exposure. If not, do not miss within the first 72 hours. Administering post-exposure prophylaxis depends on whether the serology results and the source is seropositive for any of the bloodborne virus such as hepatitis B, C and HIV. The infection control nurse reports all the needle stick injuries to the hospital infection control officer. The hospital infection control nurse is responsible for follow-up of post-exposure prophylaxis. Incidents of needle stick injury should be filled by the employee and the infection control in charge, and this should be documented for further follow-up. The consent form to be attached along with the needle stick injury form and filed regularly. Also, vaccination status of healthcare worker to be documented along with anti-hepatitis B antibody titers. Thank you.